So it's 3:30 in the morning. Remind me to never ever add new material to my class again. um, okay. This might be long, so I'll try to get through it relatively quickly. Um, we're going to talk about quite a few things, and the relationship between them will hopefully be clear at the end. We're going to start off with a discussion of our healthcare system, and then move on to some concepts in bioethics, talk about particular exploited populations, which are going to be relevant for everything. And then we're going to wrap up with a discussion of drugs. So hopefully it will all connect in ways that will make sense. Um, let's start off with a simple observation. 120 years ago, the life expectancy in this country was less than 50 years. Um, since then, we're pushing close to 80. There's actually a pretty severe difference between the poorest fifth of the country and the richest fifth of the country, a 13-year difference in life expectancy. But I guess we'll get to that. And there's also racial and other demographic differences. One of the big causes, I mean, even among the most exploited and at-risk populations, it's still significantly above 47. And part of that has to do with there used to be a lot of infant mortality. When you factored those out, a lot of people would actually live significantly longer. But also, there are lots of medical advances in the 20th century in terms of antibiotics, vaccinations, pharmaceuticals, medical devices, quality of care, and safe water is probably the biggest one. So I thought I'd give a little bit of history, because I like history. It helps us recognize that some of our problems are um, not only not unique, but are set up that way because people in the past kick the can down the road. So in the 1700s, in this country, there was essentially no public health programs of any sort. Um, in fact, the very first hospitals are formed. There's pretty high mortality. People were treated with lots of folk remedies, but there were smallpox inoculations that the, the troops in the American Revolution were forced to take. We'll come back to that in later on, actually. Um, midwives were common. By the 1800s, there were more hospitals. In fact, hospitals were built in every state. But healthcare was still viewed as a fee-for-service area. And as new surgical techniques were developed, there became more and more expensive healthcare costs. And so it became harder and harder for regular people to pay for their healthcare. Epidemics raged. Lots and lots of people died in the 1800s due to disease, as we saw. In the early 20th century, there were several pushes, largely from the labor movement, from unions, to fight for sickness and injury protections, to fight for universal health coverage. They were pushed back multiple times, close to a dozen times at my count. But because healthcare costs kept continuing to increase as more and more techniques were developed and doctors developed more specializations, people began, in unions began fighting for insurance programs, and workers began, or employers began providing them. Not that frequently, not that often, but it became a thing that some jobs allowed. One of the biggest instances during the era of the Great Depression was Henry Kaiser, who um, contracted a particular doctor, Dr. Garfield, and he prepaid for the health care of all of his workers. Um, during the Great Depression in the New Deal, FDR was pushing for some sort of universal health coverage, but under lobbying from medical organizations, he cut it out of the Social Security Act. So it didn't go through in the early half of the 20th century. In World War II, there was a Stabilization Act that passed that froze wages, or at least limited how much we could increase them. And so employers began offering health benefits, or benefits like health insurance. Kaiser Permanente formed from Kaiser's earlier approaches. And so there was some ideas of how healthcare was going to be run in this country in the future. But more healthcare bills were defeated at the time. In the early Cold War, other government health programs were attacked as communists. Unions began using the fact that some employers during World War II had pushed for providing health insurance. They fought against more employers to provide more health insurance. There were lots of medical advances in the 40s and 50s and 60s, and more people lived, and as a result, health costs began to increase. It turns out that the longer people live, the more likely it is that they'll have longer term chronic issues that will cost money. In the mid-Cold War period, Medicare and Medicaid passed. There were several more attempts at universal health care, but in essence, nothing could get through. Nixon had this plan to push for an employer mandate where everybody would be required to provide health insurance to their employees. That never ended up going through because Watergate hit, and he lost a lot of his clout. Nevertheless, there's an expansion of healthcare, some order to the system, including HMOs. Then the 80s, 90s, and 2000s. So during Reaganomics, during the period of Reagan and Bush 1, healthcare costs continued to increase, and so the Reagan administration attempted to loosen regulations in order to limit increasing health costs. COBRA passed, which allowed former employees to continue on their prior healthcare plan as long as they paid their employer's portion. In the early 1990s, Bill Clinton was elected, and Hillary Clinton was put in charge to try to negotiate a universal healthcare program, which would have had a lot of the things that people had been pushing for decades, for most of the century. That failed pretty miserably. There were a lot of ads that health insurance groups put out, arguing that it was going to increase the debt and that it was going to be unaffordable and people were going to suffer. So that attempt failed and essentially stalled out for the next 15 years, any new attempts to address healthcare globally, or at least countrywide. HIPAA passed, providing some privacy and transparency, and CHIP passed, the Children's Health Insurance Program, which expanded Medicaid to children. Good things. I was on CHIP as a child. Some of you probably were too, whether you remember or not. In the Bush era, the only thing that passed was something called Medicare Part D, which added prescription drug coverage to Medicare. Ended up being very important and helped drive the costs of prescription drugs down for Medicare recipients. It wasn't until John Edwards pushed healthcare to be a top issue during the Democratic primary in 2008, that healthcare became another top issue. And so um, Edwards, Hillary Clinton, and Barack Obama all had healthcare plans, and they debated them incessantly. When Obama was elected, ironically, the thing that he had pushed for the public option failed because he couldn't get the 60th vote in the Senate. Joe Lieberman. So the Affordable Care Act passed Obamacare, which required citizens to buy health care insurance, created some marketplaces, and expanded Medicaid. There were many attempts to repeal it. Eventually, they zeroed out the fine for not having health insurance. And in fact, there's a Supreme Court case coming up. We'll see what happens with that. About 20 million people that were uninsured were brought into underinsurance because of the Affordable Care Act. We are now in this point. Well, I think I've got the maps in the wrong order. I'm sorry. Nevada has about a 50% employer insured rate and an uninsured rate that's in the teens. It's one of the highest uninsured rates, and a relatively low employer insured rate. But it's a patchwork across the country. There's a lot of states that have uninsured populations that are very high. Many of these did not expand Medicaid in an effort to punish the Affordable Care Act, although Nevada did. But even if you have a state where lots of people are insured by their employers, in a situation like a pandemic where millions of people become unemployed, it might pose a problem. We'll talk about that later. Uninsured people tend to work. They have multiple workers at home sometimes. They tend to make pretty close to the federal poverty line, so they're uninsured, they're unable to pay. And there's a overrepresentation of the Hispanic population as uninsured. Okay, so the United States, our patchwork system actually makes us a pretty big outlier with most of the developed countries in the world. We have lower life expectancy than you would expect for our the GDP, higher infant mortality, higher diabetes and obesity rates. I always describe us as a rich, poor country. We spend nearly twice as much in terms of healthcare as the average for the G20, the 20 highest countries. But we get worse outcomes. And costs are projected to continue to increase. Okay, I'm gonna stop this video now and start the next video on the next topic, which is bioethics.